Hello, ladies and gentlemen. Hello, welcome to day number three. Day number three of the 7-day training, how to pass your GPHC assessment step by step. So, welcome everyone. I'm just waiting for a few seconds for more people to join in. Today is day number three, and we will continue harder questions today, guys. Harder questions today. More challenging questions, but again, with strategies to make them so easy for you. So I like to start off like I always do by giving a shout out to all of you that have taken the time to be here tonight. Hello, Mia. How are you doing? Lydia, great to have you. Girl like Lisa. We just finished a private session and Lisa is here already. Fantastic. Ran, great to have you. Al Gaza, Keval, Temi, fantastic. Mooman, Samir Patel. Great to have everyone logging in, tuning in right now. Today's session is going to be out of this world. We're going to have harder questions today. Harder questions today, showing you the techniques, those questions that you're struggling with, the nervousness, the anxiety, the stress. All of you, today I'm going to show you how to be relaxed, how to be calm, how to believe in yourself, and how to finally walk into that exam like a boss. Show the GPHC who the boss is. You are the boss. Walk in there and totally smash the exam. Great to have you on here, Tosif. I'm good. Life is fantastic. How are you, Nicole, in the house? Mano says, man like Marvin, you know there is man like Marvin in the house. How are you, Maria? Good to have you on. Emmanuel, thanks for tuning in. Great to have all of you. So let's go straight in where we stopped yesterday. So we've gone through day one where we introduced you to the exam. We showed you what the exam's about, how the structure of the exam. We then went into day two, which was yesterday, going through strategies, showing you different types of strategies to apply in your exam. And we will continue doing that today. So today is really going to be about questions. I'm going to show you those challenging questions, those potential questions you may get in the exam, and then also show you the strategies that you want to use to answer these questions. Marvin, I tried your technique so far today. It helped a lot. Thank you, Ali, for the feedback. Did anyone try the technique so far? Welcome, Ali. Thank you so much for that feedback. I promise you everything I teach you are practical things. And today we're going to even have more challenging questions, which again, your GPHC is not going to give you these amount of challenging questions. So my aim was always to give you the easy ones, then the medium ones, then we end up with the difficult ones so that you have a whole holistic, realistic view of what your exam is going to be like. But the good news for all of you is what we consider difficult is not going to be difficult for you because you're going to have these strategies. Those that don't have these strategies may find it challenging, but you wouldn't. You wouldn't. Charlotte in the house, how are you, Charlotte? Good to have you on. Good to have you on. So let me share my slides. We're going to go through questions, lovely questions today. But again, remember, these sessions are not about going through questions and making you nervous and making you scared and making you think, oh my God, I don't know this stuff. This session's about building your confidence. They're about showing you techniques. They're about showing you the how-to. Okay, it's the how to answer these questions. We've had the lovely Ali that's applied some of this already and is already producing results. And I know all of you will be able to produce results as well. So let me share where we stopped yesterday. So yesterday, just a general recap for anyone that wasn't here yesterday. In 2 seconds, I'm just going to give you a very quick recap on what we looked at yesterday. So yesterday was really just about looking at different strategies, looking at different techniques, and we're just trying to see how you can apply these techniques in GPHC style questions. So today what I said is we're going to focus on different things today. We've used different formulas yesterday, and we will continue to use these formulas. We've looked at recall questions. We mentioned recall questions are the easier ones. You will get a number of recall questions in the exam, but those that are normally very challenging, very challenging, are normally the analysis type questions, which are the questions that we're going to be doing today. We're going to continue with the analysis type questions. So let's see. We've got a feedback. Anyone's got any feedback? What have they done lately? Have you used some of the techniques? Let me know. Man like Tosif says, tried your way, got 85% on a mock. Highest I've ever had so far. Yes, you know, Tosif. Wow, well done. Thank you for that feedback. I promise you, these are things that will make a difference. And Tosif, you're smashing 85% without even doing I'm not even showing you the most difficult questions with the technique. So just imagine sky is the limit for all of you. So I promise you, if you apply these techniques in mocks and your questions in the next few days in exam, you're going to feel more confident. You're going to walk into the exam feeling like you understand questions. You are in control. You have steps to follow. You have the tools. And all you have to do now is walk in there like the boss and smash it. Okay. Let's do this, guys. Let us do this together. So here's what we've got. So what's today's slides? Let me pull out the slides for you. Let's share today's slides. So day number 3. I've got another feedback. Let's see the feedback from no other than the legend Tony Phillip. Tony Phillip says, works even though I have no idea about the topic. Yes, thank you, Tony. Tony, I was going to say this later on. Thank you, Tony, for bringing that up. And I do this with those of you in the private sessions. You know, we do this quite a lot. The good thing is, you'll notice that when you use these techniques, you will get questions right that you don't even have a clue about. And that is the beauty of using these techniques. You're going to be able to answer questions. You didn't even know the question. You never heard of this drug, but you walk into the exam and you still get it right. So that empowers you and that gives you the confidence to know, listen, I'm going to walk into the exam. Although I haven't covered everything, I have the tools to still get the question right. Tony, you are on the right track. Imagine walking to the exam and you've still not covered everything. And you have other trainees that have not covered anything. They're so stressed. They're so anxious, but you haven't. But you're still confident walking to the exam. Now, this is what makes the difference between trainees on the day of the exam. That's why we have a session on Sunday focusing on confidence. The difference between trainees on the day of the exam is not necessarily how much content you've learned, is the confidence that you're walking into the exam with. And it's the confidence saying to yourself, I don't know everything, but I'm still confident to get it correct in the exam. That is the level, and that was my aim for you guys, and that's where I want to get you on. I want to get to a level where you're going to walk into the exam on Tuesday, and even without covering everything, you're still going to be walking to the exam knowing I still have a chance to get it right. Thank you, Tony, for sharing that. You are an absolute legend. So let's do this, guys. Let's go into the questions today. You're going to really see more of these techniques. We're going to use it more. We're going to apply the techniques more so that in your exam, you're totally ready. So can you guys see the slides? If this is sharing, I may have to take my video out to make it a bit bigger for all of you because there are loads and loads of good questions coming your way. Good questions with good strategies. Never be scared of any question in your exam. Never be scared of a question. Even things you've never seen before. If you apply the strategies, you can still get them right. So day number 3 is all about complex questions, right? All about complex questions. But again, you're not even going to find them as complex because you have the formula. That means nothing in the exam is going to be complex for you. Absolutely nothing. So let's go straight in. So last class, yesterday, we looked at your analysis questions that require critical thinking. We said this is where students struggle the most. And this is because there are many different things that you have to look at or you have to take into consideration when you're looking at an analysis type question. But what we said we've made easy for you is rather than have this full, long, complicated list, we gave you a very good mnemonic and strategies that will be easy to remember so that when you walk into the exam, like the lovely Tosif has already tried with mocks, Tony Phillips has already tried some of this, apply some of these tools. So that once you guys walk into the exam, you have your strategy and all you have to do is go through step by step. So this session is all about showing you step by step examples. We're going to do this together. And I'm going to show you guys the difficult questions. And then we are going to smash the difficult questions together with our strategies. We have the tools. We have the weapons. We are ready for the enemy. Ladies and gentlemen, we are ready for the enemy. I've got enough feedback. Let's get more feedback, guys. I love your feedback. It helps me very much. It gives me more confidence. It makes me do more of what I'm doing. So Soheb Dad says, Marvin, I used your technique and I got 2%. Highest I've achieved. 2%. I'm hoping that's 2% more. Well done, well done. As long as you're getting better and as long as you're improving, this is the future. This is the future. So let's apply this. Most of the questions, like we showed you guys, will be this type of questions. There'll be questions with comorbidities. There'll be questions that will require critical thinking. So no problem. So great to have you on. Great to have you. Okay, let's do this now. So question, you guys can answer the questions. We're going to go in. So we looked at GPS disco, okay, or disco GPS. How many of you find this mnemonic easy to remember? Give me a me, give me a me. If you find this easy to remember, GPS disco, give me a me. Great. Cesar Senkosi, you've been very active for the past days. I remember your name. I know how involved you've been. So thank you very much for your interaction. Cesar Senkosi says, I'm really at peace now. Oh my goodness. Oh, we love peace. Oh, some Zen. I'm really at peace now. Thank you so much, Marvin. Not all heroes wear capes. Great. I'm happy for you. If you're at peace, that's all I wanted. When we started this session, I said to you at the end of the 7 days, my aim is that you feel more confident. And this is only day 3. You have exciting days coming up. There's the lovely one and only Georgina that's going to be stepping in the place tomorrow. The legend that had 100% in calculations, 98% in clinical. She's going to be coming through here, showing you how to smash SPC questions and maximizing that time. She's got good strategies for you. Then we've got the one and only legend, Uma. Uma is the man, the calculations expert, the calculations monster. Uma is going to be here after Georgina the following day, going through the stuff with you, calculation tips on how to smash calculations. Then you're going to have the one and only Rahim going through the system, how to use the SERPA system, maximizing it, and also critical thinking. And then I'm going to be back with the legendary Uma, and we're going to look at your motivation. We're going to look at things to do on the exam day, more tips for you, reducing your anxiety. Guys, you are in for a treat. It doesn't get better than this, I promise you. Thank you all for joining. 221 of us on here and still going up. Thank you, all of you. Thank you, all of you. Thank you all of you for joining. Really appreciate your support. So let's go straight into this. So the first thing, how many of you guys found this mnemonic easy? I've got loads of me's. Thank you, Mana. Thank you, Nicole. Thank you, Aruj. Thank you, Temi, for your comments. Thank you. So you guys find it easy, and that's really what I want, and that's what I like, is to make your life easy. So if you remember this, and that's why I have GPS Disco, then please use this on the day of your exam and even after your exam. Okay, as a pharmacist, use this to diagnose clinical problems. Okay, so next thing is this question. So we had this question. Can you guys all see the question? Give me 1. So this was the question I gave you guys on the first day, and I said we will look at this question because this was an example of an analysis type question. And since I'm not giving you the tools then, I didn't want to discuss the answer. So we're going to do this question together. We have a couple of questions. So with this question, what did you guys get? If you guys were here on the first day, remember, you could type your answers in. That's fine. We're going to use our mnemonics. We're going to use our tools to answer this question. So with this type of question, which you will get in the exams, a typical analysis type question, we define what analysis type questions are like. Okay, we spoke about, you have the scenario, you have the question, which is normally in black bold in the exam, and then you have your options, which are normally in alphabetical order and in lowercase. So let's use the formula. I'm going to use my pen for this. Let me use a very lovely pen so that you guys can see, so that we answer this question together. If you have your answer, you could just type it in the comment section. Please do, and that's okay. All right. All right, this is how we answer this question. We will do everything using our mnemonic. So we're going to start with drugs, right? So our Disco GPS. So the first thing we want to look at when you get questions in your exam is you look for any drugs that are in the question. Can you guys see any drugs in that question? Not in the answers, but in the question. If there's a drug, type a yes. If there's no drug, type a no. So another thing I said to you is that this covers everything, but in a GPC exam question, you wouldn't have all of this. So not all questions will have drugs in there. Not all will have issues. So that will even make your life easy because you don't have to go through all those steps, right? But at least having this mnemonic will help you cover every single thing. Great. So this is how we answer this question. We look for drugs. There isn't any drug that I can see on there. So next thing, I is issue. So what is the issue? This patient, a 70-year-old lady, was diagnosed with a blood disorder. So we have a blood disorder. I'm going to underline that, and has been suffering from recurrent urinary tract infections for several weeks. So this is very important. That's the issue. Okay. So this patient's got urinary tract infection and also a history of blood disorder. So the issue is normally what they're presenting to you now. Okay, it's what they're presenting now. Why did they come to see you? What is the issue right now? And then you've got the subject. We mentioned subject very important. So what is the subject? Is it an old lady? Is it an elderly patient? Is it a child? Is it a pregnant lady? Breastfeeding? In this case, we have an elderly lady. Very important as well. So in your exam, please go through this step by step so that you get the right answer. Then we said about condition. Has this patient got any other condition? So the patient was diagnosed with blood disorder. We've got recurrent urinary tract infections, but we also have here that the patient suffers from COPD. Okay. The reason why you want to underline all of these things in the exam is so that you don't miss anything out. Because when you're working under pressure, you may not see things. It's very, very normal. Okay. When you're working under pressure, but I don't want this to happen to you. I don't want this to happen to you. That's why I'm taking my time to show you how to do this. So then we have other. Okay, so other is normally things like blood results or anything else that's in that question that could help you. So I cannot see anything else. So these are the main ones. We've underlined this is what you want to do your exam. A Macmillan nurse has been instructed by the GP to ask you for the most appropriate antibiotic to prescribe to this lady. Okay, so this is the question. Which of these is the most? So we can circle this. What did we say about this? What does this tell us? Most appropriate tells us that this is an analysis type of question. That means that you could have more than one plausible answer, but there's only one correct answer in the exam. So we've done DISCO. So the next thing we'll do is we'll move on to GPS. So GPS is the way that we get the final answer. So we need to know some of our guidelines. So G is for guidelines. So what does our guideline tell us about UTI? What is the first line treatment? What do we use to treat UTI? So the first line is obviously trimethoprim or nitrofurantoin. So we're gonna use our process of elimination, and we're gonna try to first of all take away the things that we think are totally wrong. Right? You eliminate by looking for what's wrong. So in this case, we'll either say the answer would either be D or it's gonna be E. But then because we've highlighted these things, which you absolutely must do in your exam, I know it's an electronic exam, but you have to somehow make sure that you highlight or write these things down on a pen or something when you're doing your exam, on a paper when you're doing exam. So I don't miss anything out. So we've got nitro. So with our and trimethoprim. So trimethoprim, we know that it's contraindicated for blood disorders. So we cannot give trimethoprim to anyone that's got blood disorder. So we're going to take that off. Then we've got nitro. Remember, everything that you need is going to be in the scenario. Okay, or it might be an abstract. So everything is going to be in here. That's why we highlight them. So this patient, nitrofurantoin, with a patient that's got nitro, one of the contraindications is if they've got any sort of long COPD, long deterioration, then they cannot take nitro, right? So they cannot take nitrofurantoin. So because the patient's got COPD, we have to rule this out. So both of our first lines are all gone. We're left with three choices, A, B, and C. The answer could be any of these, could be. So we have priority and we have safety or scope. We may not need to use all of this, but we could apply more elimination strategies. So with our elimination strategy, we've got cephalexin, clarithromycin, and flucloxacillin. So one of the things that we know is that mostly with fluclox and clarithrol, they normally use more for respiratory conditions and also sort of skin conditions. So you tend to see them more with things like cellulitis as opposed to urinary tract infections. So even without knowing the right answer, we can then say it's definitely not fluclox because we normally see this with skin conditions. We know clarithromycin is normally our respiratory conditions. So we're going to cross that out. So we're left with just one option. Our only option now is cephalexin. So even if we're not experts and we do not know you could actually use cephalexin, you could still get this right just by using the elimination process and using GPS DISCO. So the answer is cephalexin. And cephalexin is used as well in UTI. Amoxicillin as well, if we had that there. But cephalexin can be used for UTI. So is this clear? Give me one, give me one, give me one. And those of you that got that correct, well done, well done, well done. Give me one, give me one, give me one. Fantastic. So that's how we use this. The more you practice with this, it's going to be so easy and it's going to be a lot quicker. So now when I use this, I could do things in 2 minutes because you don't even need to follow the order. You're just going to be thinking drugs, issues, subject, condition, order, boom, 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 guideline, priority, and you're out. So next question, question number 2. So this was a GPHC question. So I'll let you guys try this question. We'll do it together. So this is a question where we need to know our strategies again. All right, so we're going to apply the strategy. Remember, in your exam, how many questions are you going to get? How many extended matching questions are you going to get in your exam? Type the answer in the comments. How many extended matching questions are you going to get in your exam? You can type that in the comments. So your extended matching questions, which we looked at last time, you're going to get up to 30 questions, right? So that's quite a huge number. So how do you answer this question? Again, we have to always use our mnemonics, use our strategies. Don't ignore the strategy. Don't rush the strategy. Take your time with the strategy. So what I was going to show you is you're going to have questions. So we have lithium. So let's go drugs, right? We're going to go drugs. So let's highlight any drugs in our question. So this patient, we're looking for drugs. We can see lithium. So we're going to highlight that because everything the GPHC puts in there could be important, right? Everything could be important. Not everything is, but everything could. So any other drug in there, I can see ramipril. So that's what I'm going to do. I'm going to highlight ramipril. Now, once you highlight drugs, the next thing you want to think about is always try to see if there's any interaction between those drugs you've highlighted. Just think, is there any interaction? So is there any interaction between ramipril and lithium? Type that in the comments if you think there is. Is there any interaction between ramipril and lithium? So there is an interaction because ramipril could increase the concentration of lithium, right? It could increase the concentration. Now, we've done drugs. We're going to look at the issue. So what's the issue here? What's the problem? So this patient diagnosed with bipolar disorder, taken lithium for 5 years, and has newly been prescribed ramipril for hypertension. So we've got hypertension and we've got bipolar disorder. We're just looking for any issues in the presenting issue is hypertension, but there is a history of bipolar, which is going to be the condition. So we could look at the subject. Who's the subject? Because the test could be in the subject. And we want to make sure we don't miss anything out if that's where the GPS is trying to trap us. So we're going to highlight the subject so we know it's a female, 49 years old, sounds all right. It's not a child, an elderly, or breastfeeding, or pregnant. None of that has been mentioned. So it's all good. It's all good. Condition, bipolar, hypertension. Other, is there anything else? And any results? Is there any allergies? Is there anything else in that question? No. So fine, we are ready to go. Now, what strategy are we going to use? We've used our DISCO. Then we've got GPS to go through. We use prioritization strategies. But one strategy that we spoke about yesterday was the common side effect strategy. So with the common side effect, it's so important that you focus on the serious side effects. So with the common side effect, that's why I've got serious. It's so important that you look at serious side effects. So what we said was a common side effect strategy is that you look out for the drugs, look out for any common side effect. So why is this so important? This is the reason why this is important. If you don't do this in the exam, you may get this wrong because there could be more than one plausible answer. And I'm going to show you an example. These two drugs, when they interact together, ramipril is going to increase the concentration of lithium, which means we may get signs of lithium toxicity. So one of those signs of lithium toxicity, for instance, is QT interval prolongation. So some of you may see this and say, all right, since the lithium concentration goes up, so it is possible that we could get QT interval prolongation. But the reason why we're not going to use that is because we have to use the common serious side effect strategy. Always ask yourself, what are the two common side effects? What side effects do these two drugs that interact share in common? That's more likely where the answer is going to be, as opposed to just thinking an overdose of lithium or lithium side effects. Combine both drugs together. Now, this is when I spoke to you guys about plausible options in the exam, which means that you may have distractors. There are things that are correct, they're plausible, but they're not the answer, not the correct answer. Let me show you what I mean. If I highlight this, diarrhea, these two drugs can, if you check your side effects, can cause diarrhea. So lithium causes diarrhea, so does ramipril. This means a potential side effect is this patient, by combining these two drugs together, this is plausible. This patient could suffer from more diarrhea. And if you said that, that's not wrong in practice. In practice, you probably see this. But we have to focus on what? The serious common side effect. The serious common side effect. And these drugs have two of them that are in common. There is diarrhea, so this is a potential distractor. And then the second one is they both affect your kidneys, right? So they could cause renal impairment, they could affect your kidneys, they could reduce your EGFR. So because these two have this in common, the answer will either be diarrhea or it's going to be reduced EGFR. And if you don't know this, you're going to walk into exam, guys. Some of you are going to put diarrhea based on the question they give you. But if you understand that it's the serious one, always go for the serious interaction. So between these two, this is a more serious interaction. This means our answer to this question is going to be reduced EGFR. This is the correct answer. Is this clear? Give me one, give me one, give me one. Is this clear? Give me one, give me one, give me one. This is so important. Diarrhea is not serious, but it's a side effect of lithium. Thank you very much. So that's why in the GPS exam, you have to be very careful. And I could give you guys more and more and more examples of questions where you're going to get confused because you're going to think, oh, that's a side effect. These two drugs produce this. But then you do not know that you have to go for the serious one, right? The serious one. Fantastic, guys. Let's go for the next one. Thank you very much. Next question. And we're going to keep applying all of the strategies. By the way, this was a GPHC question. This was from the GPHC. So that's the sort of questions you're going to see, right? So be aware of the combined side effect, right? The combined side effect. So this is the next question for you. I want you guys to try this question, and then we'll do this together. Again, using our strategies. Another GPHC style question. So Mrs. P is a 50-year-old lady who visits your pharmacy to buy some clotrimazole cream for a fungal infection on her foot. She takes Ramipil, atenolol for blood pressure. She also takes warfarin. She has no known allergies and does not take any other medications. She has no other medical condition. So again, we're going to go straight in using our GPS, right? Disco GPS. We're gonna circle any drugs that this patient is taking, and I can see clearly what drugs do we have. We've got Ramipil, we've got atenolol, and we've got warfarin. And the patient's actually coming in to buy clotrimazole. So the first thing we do is once you highlight this, look out for any interaction with those drugs you've highlighted. Can anyone see any potential interaction? If you can, please type it down in the comment section. I can see already, if you normally combine two blood pressure tablets together, you get hypotension, right? But that's not as serious, right? So many people take more than one blood pressure tablet, and okay. But that's a potential. We can see this warfarin, clotrimazole. Do they interact? We don't know. We're going to find out. So we've taken our drugs. The next thing we want to look at, disco eye is the issue. So what is the issue with this patient? Why are they here? What is this question all about? What is the presenting complaint? So it's a fungal infection. So we're going to highlight that so that we don't miss this out. It's a fungal infection, and the location is important as well on her foot, right? Patient's got fungal infection. That's our, so we've done our eye. We could look at S, which is the subject. Who is the person? Is a child, is a female, is a pregnant lady? We're always watching out for children and pregnant ladies, right? Always. So this time is Mrs. P is a lady, but nothing about pregnancy, and she is 50 years old. So not too bad, not an elderly patient. So we're going to look at Mrs. P, 50, nothing. We've not missed anything about this subject. So what else have we got? Conditions. Does she have any other conditions? We cannot see any other condition in the question. Is anything, any other blood pressure results, anything that we need, any abstract? No. So that's done. We've highlighted that. That's the first step. So next thing we have to look at is our GPS. So what does our guideline say? So we're going to use GPS, and we're going to use process of elimination. So what answers do you guys have? Let me see some of your answers already before we go to elimination. I'm having different answers, not clotrimazole, azole, and different things. B, A, interesting. So let's see this together. So we're going to go through the process of elimination, and you guys know we're always looking for wrong answers first. Don't bother about the right one. Just get the wrong one out. So I'm going to start from the top, and we're going to go, okay, sell this patient clotrimazole as it does not interact with warfarin, but advise to monitor INR. Interesting. Let's put a question mark on there. Let's leave that. We're going to find out. Provide advice only and refer her to her GP for a prescription. Plausible. Plausible. So we're just going to put a question mark as well. Plausible. That could be an option. That could be an option. Sell an alternative antifungal as clotrimazole increases warfarin concentration. Does it or doesn't it? Does clotrimazole increase warfarin concentration? It doesn't. It doesn't. So you can check. There are the miconazole does, fluconazole, but clotrimazole doesn't. Provide lifestyle advice and advise her to check her INR first. So you could do this, but in terms of practicalities, it's not really helping that patient because she has a fungal infection. So if we're telling her lifestyle advice, eat healthy, and all of these things, and then check your INR, we've not really done something for the fungal infection. There's no action, which is not what we want because we want to have an action within our scope or referral. And the last one, advise her that fungal infections are self-limiting and will resolve on their own without any medication. We're going to cross that off because they're not self-limiting. And majority of the times, you're going to need an antifungal to treat fungal infections. So we've eliminated those. We're literally stuck with A and B. Our answer could be A or it could be B. So let's look at these two answers. Provide advice only and refer her to the GP for a prescription. So some of you may refer her. But when you look at this, remember with our formula, I'm going to go back to this formula. I mentioned to you guys about scope. This is so important. The GPHC, if there's anything, always ask yourself, is there anything I can do within my scope of practice as a pharmacist? If there's something that you could give that patient, then that should be the first action. So you always have to ask yourself, this question involves scope, right? Scope. Is there something that you can do? Because if there's something you can do, you have to do it. You don't refer them to GP, you have to do that thing to help. So in this case, is there something we can do? Yes, because we can sell clotrimazole over the counter. So why wouldn't we sell clotrimazole? If you look at this, you can because there is no interaction. Clotrimazole, so this is a plausible option. No one is going to tell you off for referring them to the GP, but this is not the best option because this takes away your scope of what you can do for that patient. So what you want to do is look at what your GPS is. So in that case, this patient, there is no reason why you cannot sell this patient clotrimazole. There is no contraindication between clotrimazole and warfarin. There is between miconazole and fluconazole. If these were different in fungals, we'll say yes, but not for clotrimazole. There is no interaction. But importantly, you could still advise that patient to monitor the INR. So what you've done here is you've given this patient a medication which is going to be safe. There is no interaction with the medications that the patient is taking. You have done something within your scope. So you've not referred them, but you've actually given them a cream. And it's a fungal cream which the patient is going to put on her foot. So it's not even oral, right? It's not a miconazole or Dactarin oral gel. Okay, so in that case, it's safe. It doesn't interact. It's within your scope of practice. So the most plausible or the correct answer, not the most plausible, correct answer will be A. Does that make sense? Type of one, type of one, type of one. So you always have to ask yourself, rather than just think, oh, that's an antifungal, that's how I'm going to refer them because it can interact with warfarin. There are certain antifungals like fluconazole, like miconazole that interact with warfarin. If those were the ones, yes, we will do that. But because it's clotrimazole and there is no interaction whatsoever, it will be wrong for you to refer that patient. In practice, it's okay, right? In practice, no one's going to tell you off in practice, and that's what the GPHC is trying. In the past, many pharmacists just refer patients, and that's why the GPHC in your questions now, the GPHC are trying to test to make sure that you're not going to be one of those pharmacists that keeps referring everyone to the doctor whilst you can treat them in the pharmacy. Okay, so next question. We're going to apply all of the strategies, guys, all of the strategies. So next question, I'll give you guys a few seconds to read the question, and then we're going to do this together. Mana says MHRA warning just for miconazole. That's right, right? It's just for miconazole. And it's not just miconazole, it's the oral miconazole. It's oral miconazole, right? Dactarin oral gel. So great stuff. Please highlight that. Olufemi says, makes sense. Well done. Thank you, Olufemi. Thank you for your feedback. I appreciate that. Thank you very much. So someone's got a question. When is Ramipure kidney protective and when is it harmful? Referring back to lithium question. So I try to make things very simple for you, okay? Because GP exam is simple in terms of the amount of knowledge you need to learn. Right? You don't need to learn detailed biochemistry stuff, right? But just generally months, I'm going to give you this. That's going to help you. Normally, just think about it like if a patient is diabetic, ACE inhibitors tend to be protective, right? If they're diabetic, they tend to be protective. If they're not diabetic, normal patients, then ACE inhibitors could have the opposite effect, right? So it could destroy the kidneys. It could impair the kidneys. So they are protective for diabetic patients. I hope that helps. And someone put that down as well. Fantastic. Vamipur is only renal protective in diabetics. It has to be diabetics. Okay. Let's look at this. Do patients commonly monitor their own INR? I didn't know they could do this. So normally the INRs will get monitored for them, but when we talk about, you have to always look for the best option. Again, when you look at this in the question, although we say, but advice to monitor INR, we're not necessarily talking about they have to do, but just keep an eye on the INR. Right? It's just literally keep an eye on the INR, make sure it's checked, and just monitor that way. Okay. All right. So great stuff. Good questions. Marvin, kindly help me with the previous question. What makes EGFR serious than QT interval prolongation, please? So Rebni Dunk, that's a very good question. Let me just put that. Sorry, guys. I just have to answer a few of these questions. I know we're going to carry on, but I want to make sure you guys are all fine. So Rebni is asking a very good question. Marvin, kindly help me, please, with the previous question. What makes EGFR serious than QT prolongation, please? Very, very good question. Now, when I talk about serious, is QT interval prolongation serious? It is very serious, right? So this is the reason, and this is why you have to always use the strategy. So if we go back, let me answer this question for you. Very, very good question, actually. It's a very, very good question. So let's go back. It was this question. So normally, we have to look into QT interval prolongation. Remember I said to you guys, you have to look for the common side effect these two drugs cause. So Vamipur doesn't cause any QT interval prolongation, just lithium, right? Just lithium. And when you combine these two together, Vamipur could increase lithium concentration. So we could say more lithium toxicity, so higher risk of QT interval prolongation. But generally in these patients, you tend to have more issues with QT interval prolongation with patients that have some sort of heart condition, right? So even if you look at the advice about QT interval prolongation, you will see that the risk, and in your exam, they'll probably mention something, maybe if this patient has some sort of cardiovascular disease. I think it's higher as well in women, I think, and elderly, but there have to be certain factors that will show you there's an increased risk, or maybe some hypokalemia, so low potassium. There will have to be some predisposing factors that will increase the risk of QT interval prolongation. If that was the answer, and if that's the answer they wanted to drive you to, you will have that in a question. You'll probably have another drug on here that increases QT interval prolongation, such as citalopram, for example. Okay, so they will put more things there for you if it was to direct you towards QT interval prolongation. But you would generally see that it will either be with another drug that causes QT interval prolongation, or it will be a patient that has some of these predisposing factors, especially some sort of cardiovascular disease. Is that clear? But that's a very good question. I hope that helps you. But that's a very, very good question. Thanks for asking that. And that's why we talk about critical thinking. There are many things that you have to look at, right, in the question. But QT interval, look for things with the heart. Benches, Marvin, you are a G. Okay, so what did you guys get for this question? So a very, very interesting question. Another challenging one, which is what we're doing today. But please, guys, it's not about getting them wrong, and it's not about you losing your confidence and thinking, oh my God, I got this wrong, so oh my gosh, I'm not prepared. Number one, these are extremely harder questions. You're not going to get many questions like this in the exam, I promise you. I'm trying to give you the harder ones so that you can see all those steps. All right. So, and I know that if you can do these ones, then it's really clear and you understand this stuff. So let's look at this. A 59-year-old man. We're going to take our time. We'll do the same thing that we've been doing. So the first thing we're going to look at is disco. We're going to look for any drugs that are involved in our scenario. So we could see over here, we've got allopurinol, 100 milligrams. I think, okay. Is there any other drug anywhere in the question? No, there isn't. So you think, okay, good. If you have another drug, then perhaps they're not trying to test you on a drug interaction. When there is more than one drug, then you need to start thinking perhaps this question is leading towards a drug interaction. That's why in the previous question, the good question that was asked about QT interval prolongation, if I was doing this question in the exam, and I'll just help you guys with this because that was a very good question. If I was doing this question in the exam and this drug, for example, was ondansetron or it was something like citalopram or some other type of antipsychotic, that, or clarithromycin, erythromycin, any of these drugs that cause QT interval prolongation, if it was that, I would think straight away that they're probably asking me a question to do with QT interval prolongation because I could see that's a commonality between the drugs. Okay, that's why we highlight the drugs so that we can see what the GPHC is trying to test us on. Okay, guys, this is key stuff. I promise you won't see this sort of critical thinking anywhere. I promise you. So, allopurinol, there's no other drug which tells us that perhaps we're not being tested on an interaction. So we'll go to the next thing, which is our I, the issue. What is the presenting complaint? So a 56-year-old man with unstable angina who takes this has been recently diagnosed with hypertension. So we have hypertension. One of the reasons why we need to know this is because most of the answers will be relating to the presenting complaint. So as a pharmacist, you're trying to deal with the presenting complaint, what that patient is struggling with right now. So we've got hypertension. I cannot see any other complaints anywhere. So we're looking at hypertension. So next thing we'll think about is, and you always get questions on hypertension exam, right? So next thing is the subject. Who we're looking at is a female, is a child, a 56-year-old man. That sounds okay. Okay, sounds okay. They've not given us the ethnicity. They've not told us if it's a Black African or anything. So perhaps that means they're probably not testing you based on the ethnicity with the hypertension. So we know the subject. We look at the condition. Is there any other condition? I cannot see any other condition. So then we go to O, which is other. Is there any other thing? Allergies, blood results, lab results, anything? And yes, we have lab results. So we've got an O for this question. So when we look at the lab results, everything we're going to have in a scenario is there for a reason. Although you have to use everything because some of the things are just added there to bulk up the question. But everything that you need to answer the question will be in your scenario. So I'm going to look at this, and I did not put the ranges. Normally in your exam, they'll probably make it easier, and they'll give you the reference ranges to help you to know which one is abnormal. But I advise you to learn at least potassium and sodium by heart. At least know the ranges by heart. So with sodium, 138 seems okay. It's within the range, right? So it's within the range, so sodium seems fine. Potassium is a bit high. We're expecting 3.5 to 5.5. So when we see 7.1, we have to highlight this straight away. Before we even go into answering the questions, we have to go, this is our O or disco other. Ladies and gentlemen, there is a high potassium. Then we look at the blood pressure. Ladies and gentlemen, this is a high blood pressure. This is a high blood pressure. Okay, that's quite high, 161/93. So according to the guidelines, so we're still using GPS, and you have this along in your exam where they're going to ask you questions according to the guidelines. They may make it easy by giving you the guidelines as an abstract question where you have to look, which Georgina is going to do with you guys tomorrow. But in this case, you may just, on some questions, you would just have to know the guidelines, and that's why we talk about guidelines. So we're going to G. Which of the following is the most? So we could see most, and we know we're looking at an analysis type question, which means there may be more than one plausible answer because we're looking for the most appropriate one. So which answer did you guys go for? We're going to use our strategies. So let's look at our guidelines. According to the guideline, this patient is 56. So what is the first line for a 56-year-old male? What is the first line? So we will think a calcium channel blocker because they're older than 55. So we're going to think calcium channel blocker. So this could be a potential answer. So let's just leave that there with a question mark. As usual, our elimination process, we're trying to take out the things that are wrong. So we're trying to get out what's not right, and then we could decide what's right. So Bendro absolutely is used for hypertension, but we can see clearly this patient takes allopurinol, which means to me that this patient has got gout. And anyone that takes a thiazide diuretic and they've got gout is going to make it worse. So we're going to take this off because this will probably not be the most appropriate because a thiazide diuretic for someone who already has gout may make the gout worse. So we've got doxazosine. Doxazosine, let's see. We don't know. We're just going to leave a question mark. It could be. It could be. We've got ramipril 10. Should we give ramipril? Could we give ramipril? Of course. Of course, it's part of our guidelines. We've got calcium channel blocker. We've got an ACE inhibitor. But ladies and gentlemen, we have a high potassium. Ramipril causes hyperkalemia. For a patient that has 7.1, watch out, right? So everything is given for that reason. Because of that, I'm going to take ramipril off because it looks too dangerous. The patient already has a high potassium level, really, really high. And I don't want to give them ramipril because that's going to make it worse. And I will definitely not give them spironolactone because this will even make potassium higher because the potassium sparing diuretic. So I'm left with just two answers. It could either be A or it could be B using my process of elimination. But which one is it? There's got to be something else in that question to help me. So if I look on there, the patient, which I did not highlight this part, which I should have, and this shows you how you could miss things on your exam. Condition, unstable angina. Unstable angina. So do you guys see what happened? When I was doing this question, I highlighted hypertension, but I missed out unstable angina. If you did that in the exam, you could easily miss that out and you could get this question wrong. If I'd highlighted that, then I would have seen that straight away. But unstable angina is a contraindication with amlodipine. So you cannot give calcium channel blockers to someone that's got unstable angina. If they have stable angina, it's fine. So it helps with stable angina. But if it's unstable angina, calcium channel blockers are contraindicated. You're not going to give amlodipine to someone that's got unstable angina. So because of that, according to the guidelines, that knowledge, that's off. So that leaves us only one answer, which is doxazosine. So the correct option, the correct answer is, the most appropriate answer is doxazosine. Is that clear? Give me one, guys. I'm taking my time to explain using the formula. So those of you that put C, well done. Sorry, yes, C, well done, fantastic. If you do not put C, that's fine. Hopefully now you will see the reason why your answer wasn't the most appropriate. Remember, ladies and gents, I'm giving you guys more challenging questions that have all the steps. The GPHC exam will not give you all the steps, so don't stress. Don't stress. It'll be a lot easier, probably 1 or 2 steps, and you're laughing. So someone's asking, why is the answer not B? So I explained not B because it's a thiazide diuretic. And if you look, the patient has got, it takes allopurinol. That means the patient has got gout. And if you give them a thiazide diuretic, it's going to make it worse, especially if you have a better option. Okay, so is this clear? Give me one. Give me one. If this is clear, I'm taking my time to make sure that you're getting this stuff. Okay, fantastic. Let's go to the next question. So that's the guideline there for you. And you could see that also in your guideline. Please learn this guideline because in every exam, they tend to give you questions on hypertension and they love this guideline. So please learn your different steps. And you can see on the different steps at the bottom, it says here, if this patient has a potassium level of greater than 4.5, you give them an alpha blocker or a beta blocker. Okay, so just knowing that sort of knowledge, if you looked at the previous question, the potassium was about 7.1, which means you probably be thinking about a beta blocker or an alpha blocker. Okay, next question, guys. Let's look at this question. Let's see if we can answer this question together. Right, so it's an 82-year-old female, and we're going to use our disco, right? So we're just going to go straight into disco, and we know fully well that it says most appropriate. So this is an analysis question. So let's use our disco formula, and we might use some process of elimination. So disco D, is there any drug involved in our question? So an 82-year-old female who weighs 55 kilograms has been newly diagnosed with non-valvular AF. Her GP refers this to you. Well, it refers the patient to you to discuss which direct oral anticoagulant would be most appropriate for the patient for stroke prevention. Her past medical history includes hypertension, diabetes. You're going to get comorbidity questions, loads of them. So the patients will have more than one condition. She's currently taking metformin. And sometimes they may not tell you diabetes. They might just tell you metformin. Previously, I did not tell you gout. I just had allopurinol, but you have to derive that from the drug. That's why we highlight everything. So with the drugs, there's quite a number of drugs there. So our D, we've got metformin. This patient is diabetic. We've got ramipril. They've got hypertension. We've got sertraline. So they have some sort of depression as well. So our I was the issue with this patient. Can we see any issue? It is right. Refers to you. Patient discuss blah blah blah. She's got a condition newly diagnosed with AF. Right. So we could see AF there. That's an issue. Anything else? Past medical history, hypertension. That's it. Right. So the issue is AF. She's got atrial fibrillation. So with the subject, 82-year-old female, important, an elderly patient, we need to watch out with them. We need to be very careful with elderly patients and what we recommend. So what else have we got? We've got C, condition. Is there any conditions we've highlighted all the conditions that the patient has? And then we've got other. Is there any other, any allergies, anything? Yes, there are some results. We've got lab results. We've got lab results over here. So with our lab results, we ask ourselves, is there anything that is out of sync? Is there anything that doesn't look right? They look fine to me. They look fine to me. So we've done that. We now look at GPS. We need to look at our guideline. So our guideline is looking at AF. Our guidelines are looking at what would we recommend for this patient. What would we recommend? So according to our guideline and our process of elimination, we could start taking things off from the slide straight away. Even without going straight in, let's try to eliminate a few things. So the first thing we want to ask ourselves, we've got a number of apixabans on there, and we've got rivaroxaban. Some apixabans are once a day and others are twice a day. So how many times do we give apixaban? Is apixaban once a day or is it twice a day? What do you guys say? Is it once a day or is it twice a day? Apixaban. Is it once a day or is it twice a day? What would you guys say? Twice a day. Fantastic. Oh, someone actually pointed something interesting, and I didn't even do the stage with you. We normally, once we highlight those drugs, we ask ourselves, is there any interaction? Don't we? We look at them and see the interaction between metformin, Ramipur, sertraline. Can we see anything? Can we see any interaction there? That's what we're asking ourselves. All right, between those drugs, they look fine to me. They look fine to me. Okay, so we've all said apixaban is twice a day. Right? You guys remember read? Apixaban is twice a day. So if apixaban is twice a day, the first thing we want to do, even without looking, going through our answers, we're going to take off any apixaban that says once a day, because we know definitely that cannot possibly be the answer. We're left with three choices, process of elimination. So we need to know what the right answer is. What is the right answer? So if we look at this question, someone mentioned something that was very, very interesting. They said sertraline can cause bleeding. Sertraline can cause bleeding. And sertraline can cause bleeding. All of this can cause bleeding, but Ramipur 10 milligrams seems really, really high. Seems really, really high. Ramipur 10 milligrams seems really, really high. So we'll probably go, let's get something a bit safer. So if we look at that, we're going to think this patient, there are certain conditions you need to have for apixaban. So when do we give 5 milligrams and when do we give 2.5 milligrams? So we'll normally think we're going to give them 5 milligrams. We'll give them 5 milligrams. That would be the dose, right? That would be the dose, the 5 milligrams to prevent that stroke. We'll give them 5 milligrams. But in this case, the patient, we have the ABCs of apixaban. So the age of the patient, how old is this patient, guys? How old is this patient? This patient is 82. So you need to have at least two of the factors to be able to reduce your dose. So one of them, the patient is older than 80, which means they already have one of those factors. And the second, one of the other factors is if the patient has a weight of less than 60. So if this patient has a weight of less than 60 kilograms, if this patient is older than 80, or if this patient has some sort of serum creatinine of greater than 133. If they have two of these out of the three, then we give them half the dose. So instead of giving them 5, we're going to give them 2.5. So it's going to be 2.5 because this patient is 82 and this patient is 55 kilograms. And so our safest, most appropriate option will be apixaban 2.5 rather than rivaroxaban 10 milligrams. That will probably even increase that risk of bleeding. The safest option for us is to start this patient on apixaban 2.5 twice a day. Is that clear, guys? Give me a 1, give me a 1, give me a 1, give me a 1. So there's more questions. Someone has written this. Thank you for writing this down. I've got apixaban. Good answers, guys. Good answers. I've got 2. Fantastic. Thank you, Mia. Mia, that's correct. That's correct. That's correct. Very, very correct. So guys, this is all interesting stuff. This is how we break down questions. Okay, the 3 factors again, someone's asking is the ABC. Can someone type in ABC for them? So there's 3 factors. The first factor is your age. The second one is your body weight. And then we have your serum creatinine. Okay, are you guys enjoying the session? If you guys are learning, please do me a favor. Please hit the like button. It helps us for the video to reach out to more people. So if you're enjoying the session, please hit the like button for me now. I really appreciate it. If you're enjoying this, just hit the like, and that's going to really help me, and it's going to help the channel as well. So someone's asking what ABC is for. So yes, so it's your ABCs. Please, if you don't know about the ABCs are Pixaban, look into that in the BNF. I don't want to obviously start teaching you guys all of this now because I really just want to teach you strategies. So, but yes, you have done the BNF. Look at the conditions when you actually have the dose of apixaban. Okay, so let's look at next question. It's almost 9. So let's look at next question. Got quite a few questions, but we won't go through all of them. Let's look at this question. Let's look at this question. Remember, ladies and gents, these are the harder ones. You're not going to get many like this in the exam, I promise you. But if you're able to do these and you understand, apply the formula, then you have no problems in your exam at all. And that's what I want. All right, let's look at this together. So we're going to do the same thing. Nothing changes. We're going to use our disco. Right, so we're going to look very quickly for any drugs in there. We could do it quicker now because we're used to it. We're going to go, fine, D, any drugs involved? Any drugs? Can we see any drugs? Patient, 36-year-old, admitted in the hospital, has got diarrhea, palpitations, blah, blah, blah. The man received intravenous fluids and metropolol. That's the first drug I can see, metropolol. Okay, I'm going to highlight that. Okay, fine. Any other thing, any medical condition? The patient has no other medical condition. Okay, no allergies. I want to highlight that because that's going to be important. That's going to be important. Okay, so we've got D for drugs. Issue was the issue with this patient. The patient's got AF. So the ECG shows AF for this patient. Patient also has presenting complaints. They're talking about diarrhea. They're talking about palpitations. Okay, is there any other symptom we can see anywhere? Not really. Okay, so we've highlighted that. We're happy. We'll move on to the next thing. So what else have we got? We've got issues. We've got the subject, the 36-year-old man. He's 36-year-old. So he's young, he's strong, hopefully fit. So not worry too much about 36-year-old. It seems to be all right, unless it's got many other conditions. So we've got disco. We've got a C, which is a condition. We're looking for other. Is there anything other? Blood results, things like that. Yes. We can see we've got heart rate given to us, which is 120. That's high. We've got our creatine clearance, 59. We've got sodium, 157, potassium 39. This all seem fine to me. Great stuff. So is there anything else we can see? Is there anything I missed out? Anything? The patient's got gout. So another condition, we've got gout. Some of these things we may not even need them, but they're just going to be in the question to bulk the question up by the GPHC. All right, so which option is the most appropriate? So we're going to look at our GPS. So our GPS, what will be the most appropriate option for this patient? So the question that they're asking, what is the question, is you are the pharmacist in the hospital ward. The nurse is concerned about the patient's risk of stroke because this patient has newly been diagnosed with atrial fibrillation. So she would like to know the best course of action to take to reduce the patient's risk of stroke. So we're thinking about risk of stroke. What will be the best option? Do we give them apixaban? Do we give them aspirin? Do we give them enoxaparin? Do we give them warfarin? Or none of the above? Or none of the above? What are your answers? What are your answers? Anyone got any answers? Or are you guys like, oh, goodness me, that's bad? Right, so let's look at the answers. I'm looking at some of your answers. Many of you are going for E, interesting. So if I look at these answers, I'm going to say to myself, how do you determine a patient's risk of stroke? You've got to do the CHA2DS2-VASc, right? So a patient's got AF. To determine the risk of stroke, you do a CHA2DS2-VASc score. So you have to work out the CHA2DS2-VASc score of this patient. The patient's a man, and for men, if they have a score from 1 onwards, then you give them some medication. That means they have a high risk of stroke. So you give them an anticoagulant. If they have a risk of 0, they don't need any anticoagulant because they clearly are no risk of getting a stroke. So the main thing we have to ask ourselves is, what is this patient's CHA2DS2-VASc score? So has this patient got anything on there to do with a heart condition, such as a cardiovascular disease, hypertension, previous history of stroke, a TIA, all of those factors you have in your CHA2DS2-VASc, the age of the patient. When you look at this patient, you work out the CHA2DS2-VASc score. The CHA2DS2-VASc score of this patient is absolutely 0. It's just a male 36-year-old. There is nothing. Okay, there is nothing. There is no CHA2DS2-VASc issue with this patient that increases the risk of stroke. There is nothing that says they got heart failure, hypertension, they're older than 75 years old, or they're between 65 to 74, or they've got diabetes or any of these things. This guy is a healthy guy that has got palpitations, got AF. So in this case, there's no need giving them anything for stroke because they don't qualify for anything for stroke. There is no risk of stroke for this patient. Very, very low risk, almost 0. So in that case, the correct answer is E, none of the above, because this patient has a CHA2DS2-VASc score of 0. Does that make sense? Give me 1 to those that got E. Well done. If you don't get E, that's okay. Please just understand what we're working at to get the answer. So Damilola, that's very good. No CHA2DS2-VASc score, fantastic. So these are critical thinking questions. Again, your exam will probably not be this difficult. They'll probably just give you the patient and give you a few conditions and they'll ask you to work out the CHA2DS2-VASc score. So are you guys ready for the next question, or do we stop here? It's already 9 o'clock. If you want another question, give me a yes, give me a yes. It's quite a lot to take in, but this is applying the formulas. Today is the last day. Well, not the last day. It's the end of day 3. Tomorrow, we're going to have the lovely Georgina on here at the same time. And Georgina is going to be going through SPC questions with you and using abstracts and how to speed up with these sort of questions in the exam. So someone asked a very good question. Why, Karimo, how are you doing? Thanks for asking your question. So Karimo says, why wouldn't it be enoxaparin? Karimo, we have to go back to the guidelines, right? That's why we have our G in our GPS disco. So according to your guidelines, Karimo, you only prescribe an anticoagulant to a patient that's got AF when they have a risk of stroke. Meaning, if they have a CHA2DS2-VASc score of 1 and above for men and 2 and above for women. So any male that has a CHA2DS2-VASc score of 1 and above, or any female that has a CHA2DS2-VASc score of 2 and above, this is when you prescribe an anticoagulant. Enoxaparin is an anticoagulant. So there is no need in this patient because they have no risk at all. If you do that, that will be jeopardizing with safety. You're just giving them something, medicine optimization, that is not necessary and will probably put them at risk of having some bleeding later on. Okay. All right. Great stuff. Great stuff. Someone says they want some more. Okay. All right. So let's go one more. Let's get one more. I've got quite loads of questions, but we'll obviously have to talk at the time. Let me see. I've got this question, but perhaps this one might be a bit easier for some of you. Let me give you one. Okay, let's do this question. I've got some really good questions. So let's do this question. We're going to stop it. Let's just try this question. Again, the main thing is not really about going through many questions. It's about understanding principles. And that's why I'm doing these sessions for you guys, compared to if I came on here and I just gave you question, answer. We're going to do a cardiovascular session. What is this answer? What is this answer? Yes, it may help you to revise, but it doesn't help you with a tool that you can apply going forward to all questions. So the aim here is not to cover as many questions as possible, is to understand the principle. And once you understand the principle, I am happy because now I've taught you how to fish rather than feeding you every day. Now you can take this by yourself, do the mock questions using this, do your revision questions using this, and ultimately use this to totally smash the GPS exam. Okay, so we're going to end with this question. And let's do this together. You guys can tell me what your answers are. Tell me what your answers are. So looking at this, we can use process of elimination. We have to use guidelines. We have to use DISCO. This patient, this is a typical question. Something similar has come up already in the exam. 45-year-old lady visits your pharmacy to collect her regular medications. We're going to just highlight. So once you're used to GPS DISCOs like myself, it's so easy. I don't even need to follow DISCO. Right? I just know it now, and you'll be like that as well before the exam. So I'm just gonna go 45-year-old lady. There's no pregnancy, there's no breastfeeding, all good. Come to collect her regular medications. I'm looking for any medications in there. Type 1 diabetes, there's a condition. This is what I want to highlight. Keyword type 1 diabetes. Oh, there's some medication, Lantus and Novorapid. This patient is obviously, as mentioned, type 1 diabetic. Lantus, Novorapid. In my mind, I'm thinking, are there any potential interactions with drugs? I'm looking out for this. Not really. Lantus, Novorapid. That's all right. These are insulins. She tells you she's feeling a bit dizzy. I'm already thinking about the presenting complaints or the issues. So we've got dizziness. So we're going to highlight that. She's coming to the pharmacy. She's feeling dizzy. Straight away, I'm starting to think a patient on Lantus or Novorapid feeling dizzy. Oh, could there be a potential of hypoglycemia? But I don't know. At this stage, I don't know. I'm just highlighting things. Okay, so you take her to the consultation room in the pharmacy. She's feeling a bit dizzy. She's come to collect her Lantus. She's feeling dizzy, like, okay, come to me, sit down. You know, I don't want them to fall over in the pharmacy. They sit down in the consultation room and you do the right thing. You decide to measure the patient's blood glucose levels. And when you measure blood glucose levels, there is other in here, other as results, like we said. So I can see straight away the results have dropped from 5.3 to 4.5 millimoles per liter. So the sugar level is 5.4 millimoles per liter. And you're in a consultation room with this lovely 44-year-old lady, type 1 diabetic. You notice she's starting to sweat. So there's a bit of sweating now starting in the consultation room. It could be part of the hypoglycemia, or perhaps she's just nervous having you, the pharmacist, doing this. Perhaps she's scared of you. Perhaps you're so scared. It's, oh my God, sweat. Oh my God. Right? So we don't know why she's sweating, but it could be still signs of hypoglycemia. Her hands start shaking slightly. Her hands start shaking slightly. Okay, so we're thinking 4.5 millimoles, hands start shaking slightly. You suspect hypoglycemia. You can only suspect at this stage. You don't really know, but you're suspecting. She doesn't take any medication. That's good news. We wanted to know if there's anything else, but there's no other medication, no allergies. We are happy. Keywords are highlighted. Key things are highlighted. We're ready to go. We could use our process of elimination. We'll continue using DISCO. So what is the most appropriate action to take? So now we're going to look at this and think, okay, let's try to eliminate something from this place. Let's try to take something out. Is there anything that you think, boom, I'm going to take this out straight away? So do we administer glucagon to this patient? No, absolutely not. So I'll just take that off. I'm left with 4 choices. So refer her urgently to her GP. Plausible. We could do that. We could refer her urgently to her GP. Remember, you refer people when you don't have the scope. Okay, be very careful about referral. Always think, is there something that you can do as a pharmacist? That's what the GPHC is testing. Okay, is there something you can do as a pharmacist? If there is, if you refer that patient to GP, even though it's safe to refer them, but you've not done the right thing, the most appropriate thing. Okay, refer them to the GP, question mark, that's plausible. Offer her a slice of bread or small carbohydrate snack immediately. Should you do that? Plausible. Offer her fast-acting carbohydrates such as glucogel immediately. Yeah, I'll say maybe. Call 999, refer her urgently to A&E. Possibly. So in a way, I'm left with 4 things. There's just one that I can take away straight and go like, definitely, I'm not going to give this person IM glucagon. No. Okay, so let's see how we're going to answer this question. What are your answers? Let me see your answers. We've got people that are torn between, this is the whole point of these questions. That's why I'm showing you analysis questions. Many people get stuck between 2. A and E can be taken off. Someone puts A and E can be taken off. Okay, so some of you are taking off E. Some are going for D as the answer. E, okay. So let's look at this. The only way we can select this is by knowing our guidelines. So we're going to say this to ourselves. Let's look at the question. Look at the patient. 45 years old. 45. She's got, look at keywords in the question. She tells you she's feeling a bit. This is very, very important. They've not fallen over. They're not unconscious. Just a bit dizzy, right? That word, a bit or a little dizzy, is very important. It will help you assess the seriousness, and then you know what to do. So this patient is just a bit dizzy. They've not fallen down, they've not tripped over, they're not unconscious, they're still able to talk, right? And they're fine. So you take her to the consultation room, and then what do? You measure the blood sugar levels. And the blood sugar levels, although they've dropped from 5.3, which you expect, probably that's why a bit of dizziness there as well. But though the sugar has dropped, the levels are 4.5. So that's interesting. Hypoglycemia, normally less than 4. This patient is 4.5. This patient is a little bit dizzy. You notice the patient only started to sweat slightly and shakes very slightly in the hands. So all of this points to the fact that this patient seems to have very, very mild symptoms of hypoglycemia. So we have to ask ourselves, what does guidelines say, right? And there's no other medical condition. Patient's 45 years old, elderly. So very, very mild symptoms of hypoglycemia in the pharmacy. So I wouldn't refer them, call 999 straight away, because why would you do that? So we're going to take this off, because is there something within your scope? Absolutely. So we're not going to refer 999, call A&E urgently. If this patient was unconscious, if they've fallen over or something, yes, straight away. If they're unconscious, couldn't swallow, yes. But that doesn't say that. Do we refer them urgently to her GP? You could, but is there something within your scope of practice that you can do? If you just refer them, that could help, but what if you refer that patient and all of a sudden the patient just collapses on the floor? Then the doctor's going to come back and ask you, but couldn't you do something in the pharmacy before you send the patient over? So be very careful. But because this patient's got blood sugar of 4.5, according to the guidelines, if a patient has got a blood sugar of 4.5, right, if they got a blood sugar of 4, it's not below 4, then according to your guidelines, you could do one or the other. So we're going to be stuck between C and D. Do we give them a slice of bread or any small carbohydrate snack? Or do we give them a fast-acting carbohydrate? Which is which? The only way you can know that is through your guidelines. So your guideline says if this patient has got hypoglycemia above 4, so 4.5, then, and the patient's obviously, you could see there's no other serious condition or anything on there, then the thing to do is to give them, offer them a slice of bread or a small carbohydrate snack immediately. If this patient's blood sugar was less than 4, so if it's less than 4 millimoles per liter, and this patient is still conscious and able to swallow, then you would give them D, you give them glucogel immediately. Now, this is the thing about these sort of questions. If in practice you decided to give this patient glucogel instead, it is not wrong. It will help that patient and that patient will feel better. So in practice, it is a plausible option, which isn't wrong. Okay, it's plausible. But according to your guidelines with a 4.5 millimoles per liter, they're asking you, what do we give this patient? What is the most appropriate thing within your reach? You could give them a small snack. Let the patient sit down in the consultation room for a little bit. You have some bread, that's fine. Give them something to eat very quickly. Consultation room, small carbohydrate snack, and that's fine. It's going to bring back the blood levels. They're okay to go, and then you can tell them to still go see the doctor later on. But the immediate action for you to take is not referring them to the doctor urgently, or it's not calling 999. It's doing something within your scope of practice. And within your scope of practice, you could either give them a carbohydrate drink, or if this was less than 4 or from 4 and below, then glucogel or some sort of oral fast-acting carbohydrate. So the answer, ladies and gents, is the most appropriate answer is C. Great. So is that clear? Is that clear? Give me a 1. Give me a 1. Give me a 1. So these are all the guidelines. So if you read your BNF and you see that you need to really look at the blood glucose level from 4. Is it above 4 or is it below 4? Where will you get bread and carbohydrates in the pharmacy? You always have, like, we'll talk about a light snack. It's the most easy. You can easily have or get it. So is it, when I say is it within your scope, it is within your scope. It is within your scope to have something, some small carbohydrate first before even getting them some glucogel or some. You can have a small carbohydrate, just small carbohydrate, it's fine. You have bread, you can get anything. Okay, so these are just showing you, making sure that you understand the steps and you know what to do based on the results that are being presented to you. Great stuff. Someone says, give them a Boots meal deal. Exactly. Exactly. So when you think about getting carbohydrate, imagine a pharmacist. Imagine you as a pharmacist, you do not have glucogel. Right? Just imagine you said to the doctor, oh, sorry, this patient, obviously, I've seen the signs of hypoglycemia. It's 4.5. I've done all of this. And yes, normally you just have to give them a little bread or give them a little carbohydrate. And you say, but by the way, we don't have this in the pharmacy. right? No carbohydrate snack. There is no bread. I cannot do this. This is not within my scope of practice. So for that reason, I'm going to refer them. Is there glucogel in the pharmacy? No. So for that reason, we have to refer you urgently to the doctor. What are people going to say to you as a pharmacist? And this is the thing. The GPHC wants you to think as a pharmacist on the day. Okay, you do what you will do on the day itself as a pharmacist. And if I was a pharmacist and if I was a doctor and a patient came to me and the patient seemed all right and said to me, listen, I was a pharmacist, they did this, and yes, I know they said I just had to have maybe a slice of bread or carbohydrate, but they referred me to you, to the doctor. You're gonna go like, what in the world is this pharmacist doing? Right, so great stuff. Thank you, guys. So we're going to stop there. So we have a lot more questions for you, but we have to stop. We have to let you guys. But the main thing is not about doing more of those questions. It's about understanding strategies. So, guys, I hope that this has helped you guys so much. Please let me know how the session has gone. Please let me know if you've learned something. If you've applied some of this, it's going to help me very much. Please help me to hit that like button. Please hit the like. It means a lot, and it helps our content reach further. Also, please share this with your friends, with your colleagues. Share them the link. We have sessions still going on every day. Tomorrow, we're going to have the lovely Georgina that is going to go through SPC extra questions. Many students fail because of time. Someone says this is not a recall question. It is not a recall question. We have done recall questions already, and we've mentioned they're a lot easier, right? So remember that these questions are harder questions, and most of the time in the GPHC, they wouldn't go through all these steps that I've just shown you. Marvin, is this the level of the GPHC exam? No, Months. I've mentioned that, yes, there are some questions that will come up. I've given you guys a mixture of some things from the GPHC exam. So for instance, is this the level? Some of them, I told you guys this is harder. I've made this specifically harder. But if you look here, let me just go back, for example. Let me go to this, for example. This question here, for instance, is from the GPHC website, right? So this is from the GPHC website, right? So again, I'm trying to give you guys a realistic way of learning. I don't want to come and make you guys panic and treat you like the mocks may treat you and just give you all these difficult questions and then totally kill your confidence, which are not realistic. That's why when we started day one, I started giving the easier ones, but not just easy. All the questions that we did from the first day and yesterday were questions from the GPHC. So I'm going to show you guys. So there were questions from the GPHC. They're all on the GPHC website, which shows you. And the reason why I chose that is so that you know the standard. Okay, so you know the standard. So if I stop this, let me show you something. So the only time that I've added new questions, that I have put the questions in myself, was day 3, because I intentionally, which is today, tried to make these questions harder, but still along the GPHC concept, but try to make it harder so that you can apply this principle and you could get better at using the principle. So that when you walk into the exam, which you will in a few days' time, it will be so easy for you to do these questions. All right, so when I showed you, let me show you guys. Let me stop sharing this and I'm going to show you what I mean. So I shared on day 1 and day 2. If you haven't watched day 1 and day 2, please watch day 1 and day 2. It's really good. But what I shared with you on day 1 and day 2, all of those questions were actually from the GPHC website. So we did recall questions which were from the GPHC website. Yesterday, we did loads of questions. They were all from the GPHC website. So if you're asking me, are these questions the GPHC standard? So all those questions we did yesterday and the day before were all questions day 1 and day 2 from the GPHC website, which are all the standard. We've still done some questions today, which are from the GPHC website, but also I've added an extra difficulty and made the questions so that you guys could get to practice these tools on harder scenarios. Now, the confidence that this is going to give you, ladies and gents, is that when you walk into that exam, you are ready for easy questions, because you will get loads of easy questions. You're ready for average questions, which are like medium strength. And then you're also ready for the difficult questions, regardless of what question comes up. As long as you use the strategies, ladies and gents, you will be fine. You will be fine. So thank you. I hope you guys enjoyed it. Thank you. I've got my video back on there. So any question? So take care, guys. Have a great time. Coming tomorrow, there's Georgina. She's amazing. She's going to smash it for you guys, and you'll get so much confidence on how to deal with your SPC questions. I look forward to seeing all of you. Take care. Congratulations in advance. I know you all smashed the exam. And remember, I'm always here to support you. I look forward to seeing you all on the other side. See you on Sunday. I'll be back on Sunday with motivation, with exam tips, and with a lot of anxiety tips for you. I'm also going to give you tips on what to do on exam day. That's going to be Sunday. I'll see you guys again on Sunday. Take care and bye.